Good morning, everyone. My name is Kajal, and today I'm going to talk about some patient's right. So, in this unit, we are going to talk about what is patient right, how it is important, and what kind of patient rights we have and we are not aware of. So, in ethics and values, in subject 3006, I'm going to talk about some patient's rights. I hope you will get to know what kind of rights are. So to understand that, to after knowing this PPT, you will get to know what is indemnity policy, what is the importance of indemnity policy, and how we can perform this policy, how we can proceed with this policy. So let's just go with the beginning and let's just talk about the definition of patient's right. So actually we will understand what is actually patient's right. So patient's rights are policies and rules that must be preserved and protected by the health facility toward the patients and their family. So whenever we are going in our hospitals, we are into a phase where we don't know what to do. But there are some patients' rights, like there are something which is a right for a patient to know, like right to know, right for information, right to speak. So like the same way, patients have their own rules in order what they can ask for, and you have to provide the thing. So that's come under patient rights. The Code of Ethics and Medical and Nursing Councils define the duties of the doctors and nurses toward the patient. Thus, these duties form the basic of patient's rights. So, right to considerate and respectful care. So, whenever the patient is there, it is a right of a patient so that doctors and nursing are treating them equally and respectfully. So, this is the very first right a patient can ask for. Right to information on diagnosis, treatment, and medicines. So what happens when the doctor is prescribing you to go for a specific test? It is a right of a patient to ask why this test is prescribed for me, what is the medication I'm going to have, what is this test is for. So it is not just that the doctor is asking you to do this, you also have 100% right to ask your doctor or the to your concerned representative that why that person is asking for that test. So you should know that why you're going for that test, what is the reason of this test, what is this test is known for. So you can know everything about what kind of a test or what kind of a medication you are going into. And the third type of a right is right to obtain all the relevant information about the professionals involved in the patient care. So suppose if you in a hospital, if you're there, you have 100% right to know what this doctor is for, like it's about degree you are concerned about. So it's a total 100% your right to know what kind of a professionals, what kind of a doctors, what kind of a nurse are involved in your treatment. So this is also a right which is come under your patient's right. And another one is to right to expect that all the communications and record pertaining to his or her case to be treated as confidential. So we have to make sure whenever the patient is coming to us, it should be a thing which is between the doctor and the patient, not even the family members. Because sometimes what happens, there are some diseases, there are something which the patient is not open or which the patient is not okay to discuss with any third person rather than with the doctor. So it is a very confidential thing, and it is a very important thing that we are keeping. We are maintaining all the documents, but we are keeping it confidentiality. We are not discussing with any random third person or even with the family member till the time the patient is not asking for, or till the patient is not giving the permission for. So we have to make sure whatever the reason behind the patient is there, it should be between the doctor and the patient, so there is no disclosure of the information of the patient. So this is also a very important thing, and the more concerning thing we have to make sure. And the right to every consideration of his or her privacy concerning his or her medical care program. So what kind of the patient is there, why is it there, what kind of a medication the patient is going for, what are the medicine the patient is having, and how long the treatment is going to take, who is the one who is performing. All these things come under this privacy thing, which we have to be very confidential. Don't have to share these things, and it is a law that we don't have to share the things. Like if we share this, there is a law that we might fail, we might face any problem later on. So we have to be very concerned about this thing without not sharing all these things with anyone. Now let's talk about some other rights. Right to beg, promote treatment in an emergency, right to refuse to participate in human experimentation, research project affecting his or her care of treatment. So there are something that we do by knowingly, spontaneously, by concern we are doing it. But there are something which if we are not okay, if I'm not okay to give my blood, if I'm not okay to donate my blood, if I'm not okay to donate my organ, that's my choice. So if you are till the time you're okay with it, that's okay for everyone. But if you are not okay with it, whether your family is pushing you toward, but if you don't want to go with it, you can't go with it, because it's your right, it's your choice. Without beyond your choice, no one can do. So if you are saying some no to something, that should be no to something. Right to get copies of medical records, so it is also a right. Whatever the test you have performed, whatever the medical treatments you are going through, whatever the medications you are going through that, you can have a proper documentation, a proper report of that, and no one can say no to that. So in order to whatever the test you are going to maintain, to ask for a medical records, to ask for your treatment trajectory, it is okay and it is your right. Right to know what hospital rules and regulation apply to him or her as a patient, and the facilities obtained to the patient. So what are the, like, different hospital, they do have their different facilities. So it is a right of a patient to know what kind of a facilities are provided in this hospital, or what are the policies which are there in that particular kind of a hospital. So it is a right of patient to know what kind of a hospital is providing what are the treatments, what are the facilities, what are the accommodations, everything. It is a right of a patient to know about that hospital. Right to get details of the bill, so whatever the amount you are paying for your medication, for your treatment, for your pharmacy, for your other collection samples, everything, it is a right for you to ask for a bill. So we don't have to feel shy, we don't have to think that whether it is right to ask or not. No, it's 100%, it's a right of a patient to ask what kind of a bill they are asking. You have to provide, because it comes under a patient right. Right to seek second opinion about his or her disease treatment. So suppose what happened, I am not okay to go for a particular treatment, because maybe I'm not willing to go, or I have a second thought, maybe I don't want to go for a surgery, or I can just be on this medicines. So this is my opinion. If I am having a second thought, the doctor, I should tell to my doctor, and that doctor should always consider it. So it is not only the one way, it is always a two way. You have your own thinking, you have your own mindset, you have your own thoughts, and we do respect that. So it is uh, I have seen some what happened, like most of the patients think that if a doctor say that this is the thing, we have to do it accordingly. No, it is, of course it is a good thing, but if there is any doubt which is coming in your mind, if you're not willing to go for a particular thing, it's okay, you can ask your doctor to do those. So you can ask it. So, what precautions should patient take to protect their rights? So, if the patient is thinking that this is the right of a patient, but it is not being fulfilled, what are the things? What are the protect we can do in order to save the patient's right? In case of surgical treatment or invasive investigation and procedures, patient should ensure that he or she has understood the nature of operation. So we should know what kind of operations we are going to talk, we are going to take, what are the medications you are into it, what are the the complications after surgery. So these are the things that come under patient rights. Patient should understand the consent form before he or she signs. So there is a form you have to fill, that you are the responsible one. If this something happens and you are the one, you can't blame things. So before signing any kind of a documents, you always make sure you are reading it thoroughly, and if there is any doubt you are having, please concern to the right person, please talk to the right person, so that you can know the in depth, which is what is written in that consent form. At the time of discharge, patients should take copies of all the relevant doctors. Make sure you are doing it in order to to save it for the future reference. You always have to make sure that you are keeping it all the relevant records. At the time of discharge from the hospital, make sure that the patient receives a bill for all the payment made, as we already discussed. In case of any treatment, patient has a right to ask for a second opinion. Second opinion always matter. If you have any doubt, till the time you should not go for it. The moment when you are ready, when you decided that yes, I have to go for it, please go for it. But if you have any second thought, if you have a second opinion, please talk to the concerned and the respective person so that you can clear your doubt and then you can go for the procedure. If patient has any doubts about the treatment, he or she should request to the doctor to clarify them, like what kind of a precaution, what type of payments are will be, what amount which will be required, how many, how long this type of uh, treatment will take. So these are the questions you can ask your patient undoubtedly. So make sure that the doctor has given patient all the instruction for the medicines prescribed. Patient has a right to get all the relevant information about the drug prescribed. So it is also like whatever the medicines you are having, you have to make sure that you should know this medicine is for what and how we can eat this, right? The treatment. You can ask anything about your relevant meditation to your doctor. In case of invasive costly investigation, patient has a right to know the alternative as well as the necessity of the investigation. So sometimes what happens, there is a lot of cost which is required for any type of operation. At that time, we can ask that, I'm not ready, or due to some reason I'm not, it is okay to go for an alternative treatment till the time you can talk to your doctors. In case of HIV positive patient, the details can only be disclosed with the patient permission. So as I said, the confidentiality, the these confidential things are very very important. Like in case of HIV patients, especially in these cases, patients are not willing or not happily open to discuss this thing, that whether they are positive or negative, to discuss with a third person. So it is very very concerning that you are not disclosing any information of your patient with any third or a random person, even with a family member, till the time the patient is not asking for. Now we are going to talk privacy and confidentiality. So as I said, privacy is always maintained in the hospital. It is always maintained within the doctor and the patient. Discuss the treatment with the patient or his or a legal guardian. Confidentiality. Maintain the confidentiality of the patient information unless it's legally needed. So till the time it's not legally needed, you can't disclose it. But when there is a legal disclosure and when it is legally asked for, at that time you can disclose it. And we have always have to make sure who is the guardian behind this patient. So in case if the patient is not in that zone, we can discuss the same thing with that guardian, which is recommended by the patient only. Refuse to see anyone not concerned with providing the health service, including visitors. Have separated male and female waiting areas. Ensure the presence of someone of the same sex in the patient in the room. So these are the things we have talked about in this confidentiality, in this patient's right. You should know when you are entering into a hospital what are the rights you have so that you can ask for. And I will always say, whenever there is a doubt, whenever the thing you are not even sure about it, ask for it rather than going with it. So it is always there, and it's a right of a patient that you have all the things with you. All you need to do is, right, you need to ask for it. So make sure whenever there is a doubt, you go and ask and then proceed further for it. Thank you and have a great day.